Hello everyone. So today we'll be discussing an important topic, medical versus surgical abortion. बहुत सी बार ऐसे होता है कि आपके डॉक्टर आपको सजेस्ट करते हैं कि सिंस द बेबीज हार्ट बीट इज नॉट देयर इन द स्कैन या फिर द स्कैन इज सजेस्टिव ऑफ अर्ली प्रेगनेंसी फेलियर. So you are given an option of doing a medical procedure as well as a surgical procedure. So which one is good and which one should you choose? So most often than not, it depends on the weeks or the gestational age of the pregnancy. 7 weeks and beyond, it is suggested that surgical abortion is best. Surgical abortion is DNE or dilatation and evacuation. Why? Because the pregnancy or the gestational age of the pregnancy has grown so much that the products of conception, what we call POCs, the size of it is significantly large. So that सिर्फ अगर हम उसको पिल्स से निकालने की कोशिश करेंगे तो देर आर हाई चांसेस दैट सम प्रोडक्ट्स ऑफ कंसेप्शंस विल बी रिमेनिंग स्टक टू द endometrial lining, due to which continuous bleeding later on can be a problem. Below 7 weeks, or if the gestational age of the pregnancy is very, very small, the baby has not developed properly, or it is below 7 weeks, then it is okay if we take MTP pills or abortion pills. But again, your doctor will already be explaining to you the risks and benefits of the procedure. But there is again a risk of 2 to 3% in MTP pills, wherein there can be RPOCs or retained products of conception even after taking MTP pills. So it is highly, highly recommended that you get a RPOC scan or a check scan done 10 days after you take the pills. Why this is done? We can get a general idea whether everything is emptied or not, whether the uterine cavity is back to normal or not, whether there are any blood clots remaining, कुछ अगर products रह गए हैं उनका size क्या है, उनको blood supply है क्या, आगे चल के वो दिक्कत कर सकते हैं कि नहीं, इन्फेक्शन कॉज करेंगे कि नहीं, आगे चल के अगर कुछ प्रेगनेंसी में कॉम्प्लिकेशन आ सकता है क्या, ये सारी चीजें आपको वो चेक स्कैन में पता चलती हैं. So it is definitely recommended to base your decision depending on your clinical situation and what your doctor is suggesting at that moment. But these are the two main avenues for doing an abortion in case the pregnancy is not going up to our mark, expected mark. And in case you experience something early on like this, early pregnancy failure, or a blighted ovum, or a missed abortion, the decision should definitely be taken in consideration with the gestational age of the pregnancy, as well as what your obstetrician is suggesting in that particular clinical scenario. Most often people think that DNC करने के बाद में uterus damage हो जाता है. So definitely not always the case. It used to happen previously when there were no ultrasound machines, or there was no guidance available to the surgeons who are doing the procedure. But nowadays, at least here, we do the DNC procedure under ultrasound guidance. So definitely we have that advantage that in case we are going anywhere beyond the uterine cavity, we are alerted in the scan machine, and the chances of any damage to the uterus are extremely less. So it is definitely a safe procedure. But which procedure to choose, definitely you should discuss with your obstetrician, and it should be chosen in accordance with your gestational age.